Welcome to the deep dive. Today, we are diving into something pretty monumental, the One Big Beautiful Bill Act. It was signed into law on July 4th, 2025.
Yeah, a date that obviously carries a lot of weight in the U.S.
Exactly. And this bill, it's not just, tweaking things around the edges. It's really the main engine for a new administration's whole domestic policy agenda. It aims to reshape huge parts of American life.
Absolutely. We're talking healthcare, food assistance, housing, taxes. Even NASA gets a mention. It's incredibly broad.
So what's really striking here is just how wide the ripple spread from this one single law. It touches almost everything, the economy, social programs.
Right. And our goal today is to really unpack that. We'll look at what the bill intended to do, at least according to its proponents, and then crucially what the projected effects are. We want to look at this from, a few different angles.
Yeah, cut through the noise a bit. Our mission is to really get a handle on these core changes and understand what this big, beautiful bill actually means for you, for communities all over the country. So maybe let's just start with the basics. What is the One Big, Beautiful Bill Act, fundamentally?
Fundamentally, it's a massive tax and spending bill,
Yeah.
passed by Republicans, signed by President Trump, like you said, on July 4th, 2025.
Okay. And the stated goal, what were they saying it was designed to achieve?
Well, the Republicans championing it, they presented it as a major effort to cut waste, fraud, and abuse across federal programs, also to secure the U.S. border, and to spur economic growth. Those were the main pillars they highlighted.
Okay, let's unpack that. Because when you look at the numbers, the fiscal impact, the Congressional Budget Office, the CBO, right, they're nonpartisan.
Correct.
They estimate this bill adds at least $3.3 trillion to the national debt over the next decade. That's a huge number. What does that really mean?
It's massive. $3.3 trillion. It's not just an abstract figure. It represents, a significant long-term financial commitment, essentially borrowing from the future.
And beyond just the debt number.
Well, that's where other analyses come in.
Yeah.
Groups like the Institute of Taxation and Economic Policy, ITEP, they've looked at who benefits. And their analysis suggests the gains mostly flow upwards.
That's so wealthy.
How so? They argue that while there might be some tax savings for lower earners, those are largely canceled out, maybe even more than canceled out, by cuts to services they rely on. Some have gone so far as calling it the most massive transfer of wealth upward in, recent memory.
Wow, that's a very strong claim. What parts of the bill are they pointing to specifically that drive that, besides just the tax cuts themselves?
It's really the combination, right? It's the tax structure changes favoring higher income brackets and the simultaneous cuts to social safety net programs, which, disproportionately support lower and middle income folks. It's that dual action.
Okay. And then on the other side, you have fierce criticism. Congressmember Alexandria Ocasio-Cortez called it a deal with the devil.
Yes, very strong language.
Criticizing the debt increase, saying it militarizes the economy, strips health care, all for tax breaks for billionaires. So clearly, very different perspectives on this.
Definitely a contentious piece of legislation.
Okay, so we've sketched out the big picture, the fiscal side. Let's zoom in now on some of the areas people are saying are hit hardest. Social programs like Medicaid and SNP.
Right, these are definitely areas seeing major, major changes. For Medicaid, the bill cuts federal funding by over $1 trillion over 10 years.
The trillion.
$1 trillion. And the projection is that could mean 17 million people losing health insurance. It's also worth noting the Senate version actually made deeper cuts to Medicaid and CHIP, that's the Children's Health Insurance Program, than the House originally passed. About 18% larger cuts.
And there are new work requirements, too.
Yes, that's a really significant change. A strict 80 hours a month work requirement for adults on Medicaid who don't have children or disabilities. That's supposed to be fully in place by the end of 2026, but states can actually choose to implement it sooner if they want.
What does that mean in practice? I mean, aren't a lot of people on Medicaid already working, or maybe they can't work for other reasons?
Exactly. That's the concern. An AARP analysis pointed out that about 3 million people on Medicaid say they can't work because they're caregivers. So right away, you see how this could really hit, say, middle-aged and older women particularly hard, since they often provide that kind of family care. It's not just about employment status. It affects, the whole network of unpaid care. The bill also puts new limits on Medicaid for legal immigrants and makes states charge copays for some services if you're above the poverty line.
Anything else on Medicaid changes?
One more detail, kind of procedural but important. A provision to ban Medicaid funding for gender-affirming care was actually struck down by the Senate parliamentarian. However, a different provision did get approved, and this one stops Planned Parenthood and similar clinics from getting Medicaid reimbursements, even for non-abortion services. Yeah.
Okay, so those are the federal changes. But how does this actually play out state by state? Because healthcare delivery is so localized.
It's causing huge ripples at the state level. These cuts could actually trigger some states to roll back their Medicaid expansions entirely. The KFF, the Kaiser Family Foundation, they projected that payments to hospitals and nursing homes would likely drop in at least 29 states.
Wow.
And overall, U.S. hospitals might lose something like $665 billion in Medicaid money over the next decade.
Oh.
That's potentially destabilizing for the whole healthcare system.
Can you give an example? Like Texas.
Texas is a key example, yeah. Projections suggest over 300,000 Texans could lose insurance. The state could lose $39 billion in federal Medicaid funds over 10 years. And that hits places like the Rio Grande Valley, rural hospitals especially hard.
And the work requirements in Texas.
It's interesting. Because Texas didn't expand Medicaid, the new federal work requirements actually don't apply to their existing Medicaid population. They only apply in states that did expand. Senator John Cornyn from Texas supported the requirements generally, saying it's not fair to the taxpayer to have them subsidize people sitting on the couch playing video games.
So what are states doing to cope with these funding cuts?
They're scrambling, frankly. Georgia is trying to boost state Medicaid funding. Other states are looking at creating new grant programs just to keep rural hospitals afloat. And Governor Abbott in Texas already released about $6 million in emergency grants for rural hospitals there.
It's clearly a major shock to the system, and it doesn't stop there, right? SNAP, the food stamp program, is also seeing big changes.
Yes, very similar story with SNAP. The bill brings in what analysts are calling deep cuts. Some say they're the largest ever cuts to food assistance benefits.
How do the cuts work?
A big part is shifting the cost. SNAP used to be 100% federally funded. Now, starting in 2028, states that have payment error rates over 6%, which is actually quite a few states, will have to cover 5 to 15% of the benefit costs themselves.
Okay, so back to the Texas example.
Right. Texas had an 8.3% error rate recently. Under this new rule, they'd be on the hook for about $716 million a year just for benefits. Plus, their share of administrative costs is going up too from 50% to 75%. That's another, almost $90 million annually for Texas. So it's a significant new financial burden for states.
And work requirements for SNAP.
Tightened, yes. Previously, able-bodied adults without dependents were generally exempt from work rules if they were over 52. Now that age goes up to 65 in states like Texas. Also, parents whose youngest child is over 14 now have to meet the work rules. Before, the cutoff was when the youngest child turned 18, so more people have to prove they're working at least 80 hours a month.
And does that have knock-on effects?
Potentially, yeah. School nutrition programs, for instance. A lot of kids get free or reduced lunch because their families are on SNAP. If families lose SNAP eligibility due to these changes, their kids might lose access to those school meals, too.
So profound impacts on those safety nets. Let's switch gears a bit and talk about housing, specifically public housing. We know the U.S. is facing just a massive affordable housing crisis right now.
It really is. Maybe the worst in a generation. And public housing, while maybe not always top of mind, plays a really fundamental role. It houses over 1 million extremely low-income households. Think older adults, people with disabilities, families with kids. It's about 10% of the affordable housing stock for that group.
But the condition of that stock?
That's the problem. Most of it is old, like 40 years old or more, and it needs billions in repairs, decades of, frankly, federal underfunding, sometimes poor management, lack of oversight. It's led to a situation where the buildings are just deteriorating.
Billions, you said.
Yeah. HUD estimated $21 billion was needed way back in 2010. The New York City Housing Authority, NYCHA, now estimates its backlog at $34 billion. D.C.'s Housing Authority needs over $2 billion. It's staggering.
And what happens when the buildings get too bad?
In the worst cases, like in Cairo and East St. Louis in Illinois, housing authorities have had to just close buildings down. And because there's often no other affordable rental housing nearby, residents get displaced, sometimes having to move really far away.
So, faced with this, what tools are actually available to preserve this housing? Or does this new bill affect those tools?
There are a few main strategies, and they work very differently. First, there's something called the Rental Assistance Demonstration, or RAD. It started about 8 years ago, specifically to tackle these repair backlogs.
How does RAD work?
It lets housing authorities convert their public housing units over to project-based Section 8 contracts. This means the subsidy stays with the building, which helps attract private investment for repairs. And crucially, RAD has pretty strong tenant protections built in, like things like long-term affordability requirements, tenants keep their rights, rent stays capped, they have a right to return after renovations without being rescreened. There's even an option after a year or two for tenants to get a regular voucher if they want to move.
So it sounds promising.
It's shown some encouraging results, yeah. Leveraged billions for repairs. It's not perfect. Sometimes the subsidy per unit is a bit low. Smaller housing agencies might struggle with the complexity. And while most residents and evaluations reported positive impacts, like feeling safer, only about half said they noticed actual physical improvements yet. But it tries to preserve the housing with protections.
Okay, so RAD is one path. What's the alternative?
The other main route is Section 18 demolition and disposition. Since around 2018, HUD made it easier for housing authorities, especially smaller ones, to just demolish or sell off properties they deem obsolete.
Wait, demolish or sell? Does the housing get replaced?
That's the critical difference. Unlike RAD, Section 18 does not require replacing those lost units with similar project-based housing. And it has very few of those tenant protections we just talked about with RAD.
So you just lose the affordable units.
You risk losing them permanently from the affordable stock? Yes. Often, residents might get a tenant protection voucher, but there are usually way fewer vouchers issued than units lost. And we know vouchers can be hard to use finding a landlord who accepts them. Discrimination, especially tough for more vulnerable folks.
Why would a housing authority choose Section 18 then if it means losing units?
Often, it comes down to money. Section 18 can sometimes allow for higher per-unit subsidy levels than RAD offers. So, paradoxically, demolishing or selling can seem more financially viable for the agency in the short term, even though it reduces the overall affordable housing supply long term.
Okay, so one path tries to save the unit and keep the resident there with guarantees. The other might give the resident a voucher, but the actual affordable apartment could disappear.
That's a good way to summarize the core difference in outcome, yeah,
Yeah.
for both the resident and the housing stock itself.
Is there anything else? Any other programs?
There's also the Choice Neighborhoods Initiative, or CNI. It gives grants to revitalize not just distressed public housing, but the whole surrounding neighborhood. It replaced an older program called Hope 6, which sometimes led to fewer affordable units overall.
Does CNI do better on that?
It tries to. CNI requires one-for-one replacement of any public housing units lost and guarantees residents the right to return after revitalization. It also includes support services. But the funding for CNI has been much lower than Hope 6 had at its peak, so its reach is limited. And honestly, it's still pretty early to know its long-term impact. Evaluations are still ongoing.
Okay, so we've covered safety nets, housing. Let's circle back to the core of this bill, really. The tax policies. What's happening there? What does it mean for, your wallet?
Well, a huge piece is that the bill makes the income tax cuts from the 2017 law permanent. Those were originally set to expire.
And who benefits most from making those permanent?
According to that ITEP analysis we mentioned, it's heavily weighted towards the top. In Texas, for example, they calculated the top 1% people earning over $800,000 a year get the biggest share of the cuts, an average of almost $115,000 per year.
Wow.
Yeah, and apparently that average cut for the wealthiest Texans is bigger than the average cut for the top 1% in almost every other state.
Okay. Are there any new tax breaks?
There are some new temporary ones running through 2028. There's a deduction for tipped workers, up to $25,000. That was a priority for Senator Ted Cruz. There's also a deduction for overtime pay, up to $12,500, though it phases down for higher earners. And seniors get an extra $6,000 added to their standard deduction.
What about the child tax credit? That affects a lot of families.
It changes, yeah. The Senate version makes the credit $2,200 per child permanently, up from $2,000. The House had proposed $2,500, but only temporarily through 2028. So the Senate's lower amount won out, but it's permanent.
Any other changes to how it works?
Yes, a couple of key things. The Senate version says only one parent needs a Social Security number to claim the credit, which could help some immigrant families. But both the House and Senate versions put a cap on the refundable part of the credit.
What does that mean, the refundable part?
It means how much of the credit you can get back as a cash payment if you don't owe any income tax. Capping it means the lowest income families, those who might benefit most from a cash boost, might not get the full value of the credit.
Got it. And anything else on taxes? SALT deductions?
Right, the state and local tax deduction or SALT step. That cap was raised significantly from $10,000 up to $40,000, but it phases out for incomes over $500,000. This mostly benefits upper middle class households, often couples, in high-tax states.
Okay, now this one really jumped out from the summary. These Trump accounts. What on earth are those?
Laugh slightly. Yeah, they're definitely a novel idea. This is another provision pushed by Senator Ted Cruz. Essentially, the government will seed $1,000 into a tax-deferred investment account for almost every child born in the U.S. starting in 2025.
$1,000 from the government? For every baby.
Pretty much. And then family, friends, even charities can contribute more, up to $5,000 a year into that account.
And when can the kids access the money?
It's structured.
Yeah.
At age 18, they can take out half the money, but only for specific things like education, starting a business, or a down payment on a house. The rest unlocks when they turn 31.
How much could these accounts actually be worth?
Well, the money is invested, pegged to a broad stock market index. So, assuming, say, 7% average annual growth, just the initial $1,000 could grow to maybe $3,500 by age 18. If families contribute the max every year, you could be looking at, $170,000 or more after 18 years. It depends heavily on those additional contributions, obviously.
And the goal behind this?
Senator Cruz was pretty explicit. He said it's a way to sell the next generation of American children on the free market system, to give every kid some skin in the game. So it's partly an investment tool, partly, you could say, ideological.
That's certainly different. Okay, are there other big policy shifts tucked away in this huge bill we should know about?
Yeah, a few other big ones, definitely worth mentioning. Clean energy took a significant hit. The bill rolls back key parts of the Inflation Reduction Act. Specifically, it phases out tax credits for clean energy projects, like solar and wind, much faster.
How much faster?
Basically, credits are reserved only for projects already running by the end of 2027, or ones that start construction within a year of this bill becoming law. Critics are calling it a frontal assault on climate efforts, saying it slams the brakes on renewable energy development.
Okay, what else? Immigration.
Immigration and the border, definitely. The bill sets aside money to reimburse Texas for the billions it spent on its own border enforcement efforts, potentially up to $13.5 billion. It also gives almost $30 billion to ICE, Immigration and Customs Enforcement, to hire more people and upgrade equipment specifically to speed up deportations. And yes, there's more money for surveillance tech and building more sections of the border wall.
What about education? Pell Grants.
Pell Grants for low-income college students, they narrowly avoided major cuts, which was a big fight. But there's a new rule. Students can't get a Pell Grant if their college is already covering their full cost of attendance through other aid. This could affect some of those promise programs that aim to offer free tuition. On the flip side, they did expand Pell eligibility to cover short-term workforce training programs, which is new.
Anything on K-12 education?
Yes, K-12 scholarships.
Yeah.
The bill creates annual tax credits for people who donate to nonprofits that give out scholarships for K-12 students, which often means scholarships for private schools. The credit is capped at $1,700 per donor per year, and states get to choose if they want to participate or not. Senator Cruz, again, he's called school choice the civil rights issue of the 21st century.
Okay, one last one that seemed unexpected, the space shuttle.
Chuckles. Right. Even the Space Shuttle Discovery gets a mention. Senator John Cornyn got a provision in that directs the NASA administrator to consider moving the Discovery Shuttle, which is currently in a museum in Virginia, to the Johnson Space Center down in Houston. Plus, there's an extra $10 billion earmarked for programs at the Houston Space Center focusing on moon and Mars exploration.
Right.
So yeah, it really covers a lot of ground.
Wow. Okay, so we've really covered a lot of ground today, digging into this one big, beautiful bill act, from the huge impacts on Medicaid and S&E to the kind of precarious future of public housing, the big shifts in taxes, those new Trump accounts, and then everything else: clean energy, immigration, education, even space.
It's incredibly wide-ranging, and I think that leaves us and you listening with a really important question to ponder. As policies like this reshape the role of government, both federal and state, in providing these basic safety nets, how are communities going to adapt? What responsibilities shift back onto individuals, onto local groups to meet fundamental needs like healthcare, food, stable housing?
Yeah, and maybe something else to really chew on is the longer-term picture, thinking about intergenerational wealth, economic mobility. How might all these changes, which seem to hit different age groups and income levels so differently, ultimately reshape opportunity in America for the next generation and the one after that? Lots to think about.